Hey guys, this is Tudor Grekin, and this is my journey in acquiring for my UKRN, and also I want also to acquire a certificate or a card which is USRN. So I'm studying really every day for me to go to or for me to be able to get those certificates because I believe these things are important to me. So let's get started. So we have new information that I received from the books or from lectures, online as well. So let's get started. So they have changed now. They have a new protocol, or before it used to be like you will answer questions like SATA questions, but this time it's going to be different for the new generation for NCLEX RN. So let's get started. It will just be super duper fast, okay? So okay. So the question here is, a nurse has just admitted a patient with congestive heart failure, like the CHF, treated with atenolol for an acute exacerbation of chronic obstructive pulmonary disease, COPD. This nurse found out that there was a potential drug to drug interaction with one of the patient's newly prescribed medication. This patient's COPD exacerbation should not be treated by which of the following drugs? So the question is asking for a negative thing. So it says here, should not be treated by which of the following drugs? So according to our latest pharmacology concept, we have this albuterol. Albuterol is beta agonist, so you know that already. It has the opposite pharmacological effect of atenolol, which is a beta blocker. In a patient taking atenolol, the therapeutic capability of albuterol may be greatly decreased. So therefore, albuterol should not be used. So you're not going to use this. So this is a drug that you should not use. Okay. In this case, ipratropium or corticosteroids, thiopylline, have no potential interaction with atenolol. So, you can give this out. Alright, so let's move on. Pertaining to diagnosis of phlebitis, like which of the following statement is correct? So, accordingly, phlebitis may present, we have fever, redness, swelling, and pain at the IV site, showing of intravenous flow, and a visible red streak extending from the catheter insertion site. Now, the treatment of phlebitis should begin with the cessation of intravenous therapy. So really, you have to stop the IV, and then you can also put warm compress while elevating the affected limb. While analgesics for pain and antipyretics may be given, generally oral antibiotics are not indicated in the treatment of phlebitis. So that's very clear as well. So, for infiltration, so we have phlebitis, we have infiltration, we have thrombophlebitis. So I remember that way back when I was in college. So, but let's just focus on infiltration. So, pain, there is pain when a patient experiences infiltration, swelling in the area around the catheter insertion site, coolness and paleness of the area around the catheter insertion site, and slowing of intravenous flow are symptoms of infiltration. So now let's proceed with coagulation studies. So coagulation studies, this is very important. It may come out in the USRN exam. So a patient with chronic hepatitis C is scheduled for a liver biopsy. Prior to the procedure, the nurse caring for this patient checks the most recent lab results. Coagulation is not assessed by which of the following laboratory tests? So we know that we are aware already of the different kinds of coagulation studies like We know the prothrombin time, we know the partial thromboplastin time, and platelet count. So, but if you are given hematocrit, it does not include in the coagulation study. So, only three here is listed. We have the prothrombin time, the partial thromboplastin time, and platelet count. However, hematocrit does not assess coagulation, but reports that the percentage of red blood cells, it detects how much red blood cells in your blood. So for example, let's proceed again with the baby. This is a pedia concept. So for example, you are given a situation that there is a 6-month-old infant. Then your concern is if the infant have a respiratory distress. So mostly the RR, so this is very important, especially for kids. So you need to be aware of the different kinds of the respiratory rates identified. So for the neonates and infants, we have 30 to 60 beats per minute. Toddler, that's 20 to 40 beats per minute. For the preschool, it is 20 to 30 breaths. And school age is 20 to 26 beats per minute. We also have adolescents 16 to 22 beats per minute. That also includes for adults. So you need to remember this thing. So anything that drops below or anything that goes up, so that's already a signal that you need to report it to your supervisor or to the physician. Okay, all right. So now let's proceed to osteoarthritis. So the guys, this is actually a mixed concept, super duper fast. It's just like you do a fast track review. So for osteoarthritis, when a healthcare provider assesses a patient diagnosed with OA or osteoarthritis, which characteristics of this condition will this provider look for? So the answer here, according to the online review, it is you need to always look for crepitation. Why? Because if there is an osteoarthritis, there should be grinding, grating, creaking, or popping sounds which occur when a joint moves. So if you can take a look at the elderly when they move, they have this grinding, grating sound. So that already explains that they lose too much cartilage. All right, now let's move on for rheumatoid arthritis, RA. So one thing that you need to look onto this is that for these type of patients seen in the musculoskeletal ward or any kind of ward wherever it is, so there is actually a decreased grip. So a decreased grip and bilateral joint swelling. So joint meaning both of the joints are going to are going to are going to swell. Now there might be some tricky or tricks, they played tricks on you, so it's like you need to really spot. So sometimes there is muscular dystrophy, they put it there. As we all know that muscular dystrophy is you can experience this in your third trimester of pregnancy. Then they can also put something there like to really to really confuse you so that you will not pass the new NCLEX generation. They will put their waddling gait. But the duck-like gait that I'm talking about, this is due to the anatomical and hormonal changes pertaining to women who are pregnant. Okay, now let's move on. So here's another question online. A nurse is monitoring a patient during a transfusion. The patient acutely develops plank, and then there's a chest pain along with a hypotension and respiratory distress. And there is an increase of heart rate called tachycardia, and scant brownish discolored urine in the patient's Foley bag is noted by the nurse. What should be the nurse's first action as well as the name of this patient's transfusion reaction? So if you can notice, there are things that there are signs and symptoms that is displayed here. We have the plank, there is chest pain, there is hypotension, there's respiratory distress, and tachycardia. So this is actually, it's not an allergic reaction. It's what we call as hemolysis. So your first nursing intervention for this is you need to stop the transfusion immediately due to hemolysis. Okay? Then you immediately stopping the infusion is the course of the action that should be done first when any adverse reactions occurs during the administration of blood produces. In the question scenario, the described symptoms and signs point to hemolysis like due to ABO incompatibility. So remember when you in college, we remember that when we are checking the blood or whether it's a pack RBC or a whole blood. So we need to have there's two nurses checking that out, looking on the doctor's order, verifying the identity of the patient, and of course verifying itself the type of if you need to have if the cross you need to also check if there is a cross match order in attached to the physician's chart. So that's what we're going to do. So for any allergic reactions, we also present with swelling, flashing. So if there's like kind of swelling, flashing, tachycardia, and respiratory distress, this already signals that there is a allergic reaction. By the way, guys, hemolysis and allergic reaction is two different. Next, a nurse is giving instructions to a patient who must give a sputum culture. Okay, so sputum culture, remember patients with tuberculosis. So the patient has consented for the procedure, so he has to sign the consent. You need to choose the instructions the nurse should give to the patients for this test. So the patient has to take a deep breath and then cough and expel the sputum into the container while avoiding allowing saliva to enter as well. So that is the standard procedure for this. So all you have to do is get familiarized with the procedure and internalize the procedure so you can pass your new NCLEX generation exam. So an emergency room, this is now in the ER. An emergency room nurse is giving a discharge instructions to, for example, a 15-year-old male suffering from orthopedic injury during a soccer game. He has been instructed to use crutches and limit weight bearing until further specialist evaluation. What describes the proper use of crutches? So according to the information that I gathered online, so you must remember that there's gonna be a 2-inch here, 2 inches, and then you put the crutch here, and then once you put the crutch, you do not need to put your weight on the crutch, but you need to put you need to transfer your weight to your hands here. How do you call that? How can I put it in words? You need to, like for example, when you're lifting your crutches, you need to understand that you cannot rely on your how do you call this, on your axilla or on your axilla though, and put your weight there, but all you have to do is put your weight into your hands here when you are gripping, and then you move. Okay, that's what I remember. It was my college instructor instructing me to these things, and I remember that because he uses various types of books. Okay, and also show that in our return demo class. Okay, so according here, you need to place the crutch, and it should be like not really less than an inch, like 1 foot, and then you need to put your weight to now I remember it's called the hand grip. So, and never rely on your armpit, whatever, as you swing your uninjured leg. So when you swing your uninjured leg, and just in front of the crutches itself. So now let's proceed to the ABG. So for example, the ABG, we know that already, right? So a patient has an arterial blood gas like ABG drone. The results are, so remember we have normal values like if my memory serves me right, I remember that potassium is 7.35 to 7.45. So if you do not know, you will be the first nurse that doesn't know that thing, because everyone in the entire Philippines or in the entire nursing industry know the pH, okay? The pH value. So you need to understand the values and use your knowledge, to your best advantage, meaning to say if because not all questions in the NCLEX RN that but you really need to apply the things that and use it to your advantage, because you could not, even if you will consume a lot of time, you cannot memorize, or you could not really try, you could not really apply everything, like all your knowledge. You could not apply all your, you could not really monopolize everything. Yeah, you could not monopolize knowledge. It's really, I've experienced that there must be a time, or there's actually a time wherein you are short of vocabulary. Okay, it happens to me in IELTS. So you will be short of vocabulary, but don't get noticed by the examiner. Sometimes you have to use fillers. I remember that when I used to take the IELTS exam. But of course, my speaking results is great. I just need to polish on my writing. And now let's move on. Here. So you have to remember that these things, like during our class, remember that there are imbalances in the in the ABG. We have the respiratory alkalosis, respiratory acidosis, metabolic acidosis, metabolic alkalosis. So and I guess I remember that if you have if you experience shock, or like excessive diarrhea, because you are losing everything. So, oh my God, I cannot. If you're losing everything, you tend to experience respiratory, acidosis. Okay, whether metabolic or respiratory. Then, if you have too much vomiting, this is called alkalosis. So from if it's in the mouth, it's called alkalosis, and if it's down there, it's called acidosis. So I remember that. So you need to apply these things, as I've said earlier. They have the new NCLEX RN styles, and so good luck. Okay, so next, a pH lower than normal range of 7.35 to 7.45 indicates an acidosis. Higher would be an alkalosis. So if it occurs, there's a respiratory acidosis, and it happens if the PCO2 raises to the retention of CO2 in the blood. So the normal range for the PCO2, your bicarbonate, is 35 to 45. This can be due to either reduced pulmonary function, or if the lungs, is not able to excrete that, is not able to release the carbon dioxide. So and there's too much of the carbon, or we call that overproduction of carbon, or both. So in any case, the body's response to this change is offset. It will slow increase in plasma your bicarbonate, which occurs in the kidney. Normal range of bicarbonate, by the way, is 22 to 28. And the compensation, it's called metabolic. There will be a low pH and also a low. All right. So so you need to review these things, okay? So anyway, so a middle-aged female with Meniere's disease. So we're talking now of Meniere's disease. So from the word Meniere, meaning there is really a problem in your hearing. So we have many patients, elderly patients actually, and they have a severe attack of Meniere's. And which of these would be the least helpful assistive device to implement into the care plan for this patient? So, of course, if the answer is a utensil cup, that's gonna be right. So, according to the new information here, Meniere is a is a disease, and it affects your hearing loss. And of course, many patients experience a ringing of ears and dizziness, or ringing of ears, by the way, is called tinnitus in scientific term. And you could actually provide a patient shower chair. So this may come out in the SATA questions. Remember, the shower chair, the walker, and the personal sound amplifier, because this elderly woman cannot really hear, and would be helpful devices to enable the patient maximum independence during her hospitalization. So, according to the answer here, a utensil cup is helpful for their who has weakness or difficulty holding the utensil due to contracture or deformity. For example, the elderly women, they are given utensil cup, and they have. If, for example, if there is a patient who is having deformity and contracture, of course, a utensil cup is not needed anymore, because it has a utensil cup, meaning it should be the nurse has to provide this, because the patient has difficulty holding the utensils. Okay, so now let's proceed. A 35-year-old male is brought to the emergency room by his wife, and she states that her husband has had the stomach flu. Then, according to the question here, for the past 2 days, the patient experiencing intense diarrhea and vomiting. So, during the interview, the patient tells a nurse who is caring for him that he's weak and fatigued, along with complaints of lightheadedness, muscle spasms, as well as numbness and tingling in his extremities. So if there's a tingling in sensation in extremities, it would entail that the patient is maybe he lacks multivitamins, or tingling sensation. This might pertains to the nerve, right? So, or calcium, okay? Alright, so the nurse is the first to review the laboratories ordered by the practitioner. Based on the patient's history and symptoms, which of the following results should be reported immediately to the ordering practitioner by the nurse? So, of course, as I told you earlier, if it's pertaining to your hands, movement of your legs, or anything that moves in your body, so you need to check the potassium. This patient is having the symptoms of hypokalemia. You know what? Potassium is so important, because, and I remember when I was still in the ward, there is a drug for that. It's called Kalium Durol, to increase the potassium levels of your patient, because potassium, really, if you have a deficit for that, you will have gastrointestinal system. There's gonna be a diarrhea, vomiting, as well as no, not really diarrhea, sorry. So, if you have experienced potassium, there's a problem. You can experience like tingling sensation in your hands, um, potassium also has an effect, or has a direct effect on your heart, on your cardiac system. Okay? So next, and a female comes to a healthcare unit with complaints of abdominal discomfort. She states that watery stool has been leaking from her rectum. This could be a sign of, so this is called a fecal infection. All right. So next is we have here acupuncture, acupressure, and acupuncture. So least likely this will not come out in the exam, because this is just a nice to know things. But if this will really come out in the exam, you need to remember three things. You need to look at the patient chart if the patient has a pacemaker, and of course the patient has a you know barbiturates. I mean, no, not really, seizure disorder, and has is engaged in Coumadin therapy. So, it has been proved that acupuncture can successfully help clients reduce or cease smoking. Alright? This is a good to know things. It is a non-pharmacological alternative therapy used for many other medical conditions. Okay, so we know that that's China. That's very famous in China, and I think Western healthcare adapted it out like the acupuncture, the acupressure, the yin yang, whatever. Okay, so rebound tenderness. Let's look up another concept. Is called ulcerative colitis. So we have when you check the peritoneum, so there is a rebound tenderness, and of course it already indicates peritonitis, which could be the results of the rupture of the colon. So by the way, good luck to people who are suffering from colon cancer or colon diseases. So and it's very excruciating that my dad passed away because of that kind of ailment, and sadly I miss him. Okay, so myocardial infarction, we have the MI. Of the cardiac enzymes listed to troponin, so the enzymes that you could detect for the myocardial infarction, MI, so troponin I and T. All right, so you need to look for these things. Anyway, I do not need to focus on that because you know what, the new NCLEX RN exams, it's gonna be the new NCLEX generation exams for the RN. It's going to focus more on general knowledge and content base. So if you do not know anything about content, good luck. All right. When caring for a patient to a septic shock, so a healthcare provider should prioritize to administer. So remember, if there's a septic shock, the patient loses the fluid. So what you're gonna do? So you need to put on a lot of IV fluids to increase the vascular volume of the patient. Now, you are in charge of caring for a patient suffering a severe traumatic injury. And this man has currently been catheterized. So there is a catheter attached. During your shift, you find that the patient has only produced 150 cc of urine. So 150 cc of urine, that's like scant, right? So, or it's not normal. Then you check his total output in the past 24 hours. So in the input and output record, it is 350 cc. By definition, this patient is diagnosed with, so the correct term for this is oliguria. So we have there oliguria, anuria, remember that? So oliguria refers to a total urine output of less than 400 cc in a 24-hour period. So you check the urine output 7 o'clock, 11 o'clock, 12 o'clock, 24 hours. And if you notice, if the urine output is less than 400, automatically this merits already the oligarya terminology. So anuria is also another type of urine disorder, refers to a total urine output of less than 500 cc in a 24-hour period. We also have dysuria, refers to painful urination and is not related to urine quantity. So we also have polyuria, is a total urine output of more than 2.5 liters in a 24-hour period. 2.5 liters. Okay. What is the name of the interaction in which a drug's effects is increased after a second drug is given? So there are two kinds of drug. So the first drug is given, for example, losartan or any kind of tablet or capsule, and then there's another one given also for the second drug. This term is called potentiation. So remember, there are many terms there like synergism, but this is the correct one here is potentiation, which is a type of drug interactions occurs when two drugs are taken together and the action of one drug increases the action of the other, causing the pharmacologic response to be greater for one of the drugs. During an assessment of a patient experiencing acute hemorrhage, what would the healthcare provider most likely expect to find? Of course, that is called increased heart rate. And that answer is tachycardia. The heart rate will increase with a view to delivering more oxygen to the brain and the body. Of course, remember, if you're gonna be prioritizing, you should prioritize first the circulation, airway, and breathing. So everything that should be lungs, so that's your code there. So circulation. So of these four patients who would not be determined at a significant risk for aspiration, by a nurse. So if a patient is vomiting from a gastrointestinal illness, so that's just very normal. It's not it's not something that's need to watch for. Okay, a healthcare provider is caring for patient on a ventilator with an endotracheal tube in place. So there is an endotracheal tube in place, ET, at the tube has migrated to far down the trachea. Here is indicated by which of the following assessments. So decrease breath sound. So you check the breath sounds here on the left side of the chest. Left side of the chest. This is the right side. Left side of the chest. So if there is actually a decreased breath sounds there on the left side of the chest when a patient is in the ventilator, and is in place with endotracheal tube, possible that the endotracheal tube has been not really it's dislodged. Okay. When the endotracheal tube is inserted too far, it often goes into the right main stem bronchus. Then air will be delivered to the right lung instead of the left one. Oh my God, this is so dangerous. A low pressure alarm indicates a disconnection or a leak in the circuit. A high pressure alarm can indicate an obstruction such as a kink in the tubing or a need for suctioning. So you need to suction it out. When a nurse prepares to administer packed red blood cells to a patient, of course, there's a consent. There is, as I've said earlier, there's a nurse verification system process. But the first thing that you should do is you have to check the patient's identification. Next is we have the psychosocial integrity. So these are now the drugs, the pharmacological drugs in mental hospital or in any psychiatric ward. Yeah. Okay. So here, what would be the healthcare provider identify as a cognitive alteration when assessing a patient with severe depression? So severe depression. So of course, severe depression, remember, if it's mental, it also expressed physically. So there is a somatic delusions here. Patients diagnosed with depression may experience cognitive, affective, behavioral, or physiological alterations. A cognitive alteration associated with depression is a somatic delusion, which is a false belief that the patient has some physical defect or disease. Example, the patient think he or she has an internal parasite. Yeah, just imagine. Alright. A nurse is preparing to administer an enema to a 64-year-old client. So remember enema? Enema. Which of the following actions of the nurse is most appropriate? So of course, you need to apply a lubricating jelly to the tip of the catheter before insertion, and the patient is in seams lateral. When administering an enema to a client, the nurse should place the client in a seams position, correct, for easy access. Then lubricating the tip of the catheter. Of course, you should wear gloves, right? Follow the standard procedure. Should instill a maximum of 750 to 1000 cc of fluid for the adult client. So enema, actually guys, we have different kinds of enema. We have the retention enema, return flow enema. Let me just check. A fat soluble vitamin D are those. Okay, so remember there is also vitamins here. So we have the fat soluble and water soluble. So when we talk about water soluble, these vitamins just go out. But when you talk about fat soluble vitamin, these vitamins will store in your body. But the problem with this, it's okay because you have stored vitamins in your body, which is actually very good, beneficial to you. But an excess of this may result in many different kinds of toxic into your body as well. So you just have to drink moderately, or you need to follow the physician's order. Okay. So we have the vitamin A, E, D, and K as an examples of your fat-soluble vitamins. Alright, a nurse is preparing to administer an enteral feeding through a gastrostomy tube. Before administration, the nurse aspirates some stomach contents. So example, you are now feeding the patient, and then after that one, in the NGT tube, you aspirate. When you aspirate and you see that the level of this that there is a pH level. Remember guys, there is also a pH level in your stomach, and there is also a pH level in your in your blood. Okay. So according to the theory here, if the feeding is less than 4, it's gonna be okay. So here the example is 3.9. What is the next action of nurse? Of course, you need to feed the patient. Administer the feeding as ordered. So checking the pH before administering an enteral feeding verifies the placement that the gastrostomic tube is in the correct position. So remember, there are many kinds of tests whether the tube is in place. We have the pH, we have the, not the ultrasound, but I think it's an X-ray. So a pH of 4 or less indicates that the tube is in the stomach, and the nurse may continue with the feeding. How many cc's are there in 25 ounces? Of course, 750. There are 200 cc per ounce. These are 750 cc in 25 ounces. Okay, because you just need to multiply that out. So, anatomy. Like your bone here, the greater trochanter is found on the bilateral aspect of the proximal femur and is a bony process that is large. This process forms the attachment site for many muscles of the lungs. This is just nice to know things. A patient who is blood type AB, so this is very important, can receive what? Packed RBCs from a type O donor. A patient who has blood type AB has AB antigens on his red blood cells. A donor that has antibodies of AB antigens cannot donate plasma to an AB patient. Of the above listed answers, only an O-type donor can donate to this patient, as O donors have no antibody stimulating antigens and no donated antibodies since the donation was packed with red blood cells. Okay, I'm just going to study that out. So, yeah, we have blood type compatibility here. So, it says here that a patient who is a blood type AB can receive a packed RBC from a type O donor. So, remember the universal donor is O, right? And then the universal recipient is, okay, I think I forgot that out. So, let me just check on that. Okay, but in my knowledge, the universal donor is O, and the recipient, the one that receives always, is type AB. I'm not really sure. So, let me just check that out. Okay, so let's continue. To properly read meniscus, so remember we have the meniscus here. So of course, hold the measuring device at the eye level. Remember before we have a mercury thermometer before. When we do this thing like that, it was already phased out because mercury is very dangerous. We replace it with the digital ones, and so you have to read the meniscus on your eye level and read the bottom of the curve of the liquid level. So a physician has written an order for 2.0 mgms at 22 hours PRN. Okay, this is incorrect because you will not abbreviate the MS, especially if the doctor. So what is MS? What is MS? So you need to question this order as well. So contact the physician to rewrite the order because MS is just an abbreviated. It can be whatever drug it is. So you need to fully write the word. Write the name of the drug. This order has errors that could potentially result in harm to the patient if not followed correctly. The use of 2.0 involves a trailing decimal point which can cause confusion as to the dose of the drug. Correct. The abbreviation MS is one of the Joint Commission's do not use abbreviation as this could mean yes, so you will never even, so the Joint Commission's rule is that when you as a physician will put an order, it should be a complete name of the drug, the brand name, the generic name, all of that. So you will not dare put MS 2.0 because you are in a hurry. Okay, as this could mean morphine sulfate or magnesium sulfate. Okay, so those two are different. Morphine sulfate belongs to a class of pain relievers, and magnesium sulfate usually they use it in for pregnant women. Although the order states the drug should be used for pain, the nurse should clarify with the physician as to the exact dose and drug to be used. All right, so I guess I have so many. I've done everything here. So this is just a 1 day thingy. So okay, I've studied so hard, and yeah, as nurses, we should not stop learning. I'm so amazed by one of the online instructors telling that as far as you can go with your knowledge, you need to really you need to try an attempt. But if you can only pass once, you can. And there was even one nurse who passed the new generation NCLEX exam for several times, and this patient had a stroke because he really studied very hard. And to me, that's really an inspiration because um, it's like you really swear an oath that to be a nurse, you must do everything in order to serve a lot of people before you end up. All right, bye bye, take care, and watch for my upcoming YouTube videos for pharma, for OB, for OR, for fundamentals of nursing. Yeah, all of it. We'll study all of it before the new NCLEX generation. So probably if God's willing, and I can find an agency that can facilitate all of my papers, then um, definitely will take these exams, and also take my English exam, the IELTS, for me to get my UK RN certificate, and also the USRN. So it's gonna be a plus. It's gonna be worth the journey because you know um, to have those things placed on your name, it's gonna be a great honor. And most students, near or far, they will idolize you. They will never forget you because you really achieve a lot in this lifetime. So goodbye and good night.